All right, so welcome to our presentation on meaningful data collections, for E-MDTs. And our presenter today is David Burns. So we're going to go through some quick housekeeping before we get started. Next slide, please. All right, as usual, you've seen this before and you will definitely see it again. Our disclaimer here that the opinions, findings, conclusions, and recommendations expressed in these materials today are those of our contributors and do not necessarily represent the official position or policies of the US DOJ. All right, and housekeeping, as always, you guys are all experts. Because we have a relatively small group this afternoon, we can have this kind of be a little bit more of an interactive presentation. So I know it says mute unless speaking, but if you do have a question or do have something to add during this time, feel free to unmute, raise your hand, and really engage with the content. David is super open to having this be interactive and really have it be a space for you all to kind of ask your questions that you might have with an expert on hand. So that's going to be super useful to you all to kind of use this time as such. If you would like, please rename your Zoom square to include the name you'd like to be called. I think everyone looks good so far. And if you don't know how to raise your hand, if you do have a comment or question, that's going to be under reactions at the bottom kind of strip of your screen. And there should be a raise hand button. There's also some fun emojis if you would like to use those as well. We won't be doing breakout rooms today, and there will be only one poll question. The others will be kind of all participatory. So no need to worry about that. And of course, if you have any questions tech related, please feel free to privately chat me or email me at the email on your screen. Next slide, please. All right, so our wonderful presenter today is David Burns. Dr. Burns is an associate professor and associate dean at the University of Toronto. School of Social Work. He holds a Canada Research Chair position on preventing the mistreatment of older adults and got his PhD from Columbia University School of Social Work in New York City, concentrating on gerontology and advanced practice. His program focuses on the issue of elder abuse, including the development of basic science, risk factors, prevalence, severity, and the design, evaluation, and measurements of interventions to prevent the mistreatment of older adults. He has advised major international organizations on these topics, such as the World Health Organization and National Institutes of Health. He also advises different levels of government and nonprofit organizations, such as state-level adult protective services programs, on the development and implementation of elder abuse support programs and prevention strategies. Dr. Burns' interest in elder abuse stems from both family experience and clinical practice with older adults. So we have an expert here with us today. You all are in very good hands. So again, feel free to interact with this content and interact with David. So I'm going to turn it over to you.
Okay, wonderful. Well, thanks so much for that that very kind introduction, Anna. And I would like to, reiterate what Anna was saying there. This is a smaller group, and I would like to encourage people to not, by all means use the chat bar, but please, my preference would be to actually talk, and so please feel free to do so. I thought I would sort of, given the kind of smaller crowd, or perhaps we could just kind of do a quick go around. You could introduce yourselves and just sort of let me know where you are coming from and what your role is in regard to your MDT. That would be great.
Yeah, I can start us off and then go down the list that I can see for the participants, if that's easier. All right, so I already introduced myself. My name is Anna. I work with NCAL, the National Clearinghouse on Abuse in Later Life. So I'm here to help you with any technical assistance issues. And we are going to turn it over to Lisa.
I'm Lisa Furr. I live and work in Richmond, Virginia, and I'm part of the national team around TA I work for Lifespan of Greater Rochester, and I'll be interacting with y'all on the PLGs and things of that sort. We have three new grantees, so good to see y'all here.
Awesome. And let's jump to Emma.
Hi, my name is Emma Girl-Smith. I'm with Legal Aid Society of Metropolitan Family Services in Chicago. And I coordinate the MDT that we do, which we call the Financial Exploitation Intervention Team.
Awesome. And Bernadette?
Hi, I'm Bernadette Snyder with the Pearl program here in Rockdale County, Conyers. Here I am. That's about it. I'm just the program coordinator.
Great. And Betsy?
Hi, everyone. I'm Betsy Ferner. I am also from Lifespan, but I am based in Syracuse, New York. I'm on the national team as a technical assistance advisor with Lisa. So thank you and welcome to our new grantees.
And Carol?
Hi, I'm Carol Sewell, and I'm with the California Elder Justice Coalition in California, and working on coordinating a new expert level advocacy team to work on systemic issues that are encountered by local multidisciplinary teams.
Great. And Denise?
Hi, everybody. My name is Denise Hollenbeck. I am the I-Team Coordinator under Adult Protective Services in Stark County, Ohio. I'm a 2019 grantee, but I'm excited to always learn additional ways that we can, I think, kind of enhance what we're doing as far as data collection. So happy to be here today.
Great. Grace?
Hi, everyone. Grace from the National Center. Very glad to be seeing everyone today.
Awesome. And Kylan?
Hi, I'm Kylan, Lead Technical Advisor from the National Center out of Weill Cornell Medicine. Happy to be here and see everyone today.
And Phil?
Hi, everyone. My name is Phil. I'm the Program Specialist for the National Center.
Great. And Rebecca?
Hi, I'm Rebecca Beaumont. I am the MDT Coordinator for the State of Utah Adult Protective Services.
Perfect. And last but not least, Stephanie.
I'm Stephanie Edwards. I'm with the Peninsula Elder Abuse Forensic Center in Yorktown, Virginia, and I am the E-MDT coordinator.
Great. All right. That's everyone.
Okay, great. Thanks so much. Please, again, feel free if you have any questions or comments, you raise your hand or jump in. So the objectives for today's meeting are to, this is the general topic here, that is data collection. And we're going to be talking about the value of quality data collection, any kind of barriers to quality data collection, and try to identify strategies that might help us overcome these barriers towards more sustainable data collection. So it looks like we've got a poll here. Should I pause? And
yeah, so we can just do this quick poll. We kind of already went through where you all are coming from, but just so we can kind of see visually who we have today. This should be popping up on your screen, and I will share the results in just a second. So we can see that we have a good mix of folks with us today.
so the value of data collection. So before I get into some of my thoughts, I guess I'm wondering, and you know, I'm going to be doing this a few times here at the meeting here. I guess I'm curious from your perspective, where you're coming from. You know, a lot of this does really depend on the specific circumstances or the specific context from which you're coming from, each of you are coming from. And so I'm wondering from your perspective, why data collection would be important. Like, why is this of interest to you? Why is it something that you may already be doing or wanting to get into at a deeper level? What's driving this for you? It'll help me, I guess, understand the context over the rest of the meeting.
So I have sort of thought. So with our MDT, we have, you know, services, you know, all types of services. So, you know, we have legal services, but also like public guardian and APS, and different organizations that provide, like NAMI is part of it. And so because it's so diverse, we really want to help develop the referral process, and, kind of recording case types and looking at case types and trends, I think is going to be part of like developing the referral process and kind of understanding what, for our organization, like what type of legal services need to be built out, where there might be a need. So I think sort of understanding where the need is and what the client base is really going to be helpful for us in like developing the program.
Okay, that makes sense. Yeah, great.
I think for us, like when we first started, we were wanting to make sure that we were collecting data that was relevant to the grant. But I would also say that there was information outside of the grant that we were really trying to make sure that we were capturing so that we could show an improvement through the work that was funded through the grant. And then also look at, because the funding source is not sustainable at this point, other than an extension, what data could we be collecting that would be relevant, that would highlight how important it is to have this program funded or this position funded, the benefit to individuals, the benefit potentially to the organization, the benefit to the community or to other partners, as well as collecting that type of information that goes outside of like standard VOCA data.
Okay, that makes sense. Yeah. Yeah, so trying to somehow establish the value of the program.
I would like to just add that from our perspective, we will be doing a lot of what I think Emma mentioned, trying to look at referrals coming into us from the local MDTs, and basically tracking the number of issues that are common and that need the higher level focus that we'll be providing. But we'll also be advising a new state body called the Elder and Disability Justice Coordinating Council. And part of their role, along with policy recommendations, is to be developing better data that the state collects on elder abuse. And we have very little at this time. So I think that understanding how this could be translated for their use would be real helpful to us.
Wow, that sounds great. Okay. Forming sort of higher level policy and higher level coordinated data collection. So, yeah, I mean, I think you've each hit on like three different really important, sort of reasons to collect data. I think it was Emma who started and was talking about, I think, what I'm sort of referring to in the second point here, which is collecting data to help inform your kind of your day-to-day operations and management. So in this case, you're particularly focused on the referral sources. And this really is, I think, part of data collection that is sometimes not quite obvious on how helpful it can be to your day-to-day operations until you start collecting it. And we're, for example, rolling out an elder abuse intervention program across the entire state of Maine right now called RISE. Collecting data on sort of kind of the basic, even just the basic characteristics of our cases, for example, have helped inform, for example, that there's a disproportionate number of self-neglect cases being referred to us, which we weren't expecting. And we had to figure out, and that helps us figure out, like, so why is that? Why are we getting all these self-neglect cases and not cases of like physical abuse or emotional abuse or financial exploitation, for example? And it helps us kind of go back, kind of upstream to help kind of refine that process to make sure, we're educating social workers and caseworkers around that, what's an appropriate kind of referral. I mean, that's just an example, but I mean, I think, the point here is that to Emma's point, it's sort of, it's kind of like, kind of data, smart data, like, without collecting data, it's difficult to kind of refine your operations, identify gaps, identify areas for improvement, highlight areas that you're succeeding. So this is really important. We then heard about the value of data collection to, I think, to the fourth point here on the slide is to evaluate how well the MDT program is working. And, you know, I think like, you know, you can't do this without collecting data. You know, this is a different kind of data. You're getting into more sort of like outputs and outcomes at this point. But, you know, we're going to talk a little bit more about that. But I think, you know, particularly important, as was mentioned before, to help funders recognize like the value of your program, which is increasingly over time important to continue getting funding. But it's also, I think, just sort of, again, kind of evolving, refining your model so that you know that what you're doing is helping, right? I mean, at the end of the day, that's the point. And then I thought, you know, the other point here around kind of feeding into a larger kind of, in this case, like in California, statewide kind of coordinated data collection effort. And that's an amazing step that I think we can all learn from once you get that going. So I think a lot of these points were kind of covered here already, but yeah, hopefully that gives us a sense and also some additional ideas as to why you might want to collect data. So what are the kind of different types of data that MDTs tend to collect? And so what I'll say before I get into these slides is that myself and my colleague Tony Rosen at Cornell Medicine, as well as a couple of our associates, Alyssa Ellman and Darren Kirchen, went through quite an exhaustive process. This was a couple of years ago, in which we reached out to and surveyed as many MDTs across the country as we possibly could. And it's possible that we even reached out to some of your MDTs at the time. But basically, in the end, we got in touch with about 15 MDTs who sent us their data collection systems. And we did a very, very kind of refined and fine detailed recording of all the different data elements that each of these MDTs were collecting at the time. And we tried to get a sense of, like, you know, what should, based on this, based on people were doing, and there's a huge amount of variation, not just in terms of the, you know, the data elements that people were collecting, but also, like, you know, the way that they operationalize each one. I mean, something just as basic as like type of mistreatment was actually being recorded and captured in 10 different ways, for example. And so the purpose of this exercise was try to come up with some kind of standard so that we could, you know, eventually we can start working towards kind of a national sort of standard in which, you know, we're all kind of feeding into one centralized system and gives us a better sense of you know, we can kind of work together on this. So this is where this kind of comes from, and these recommendations come from. So there's different types of data collection. You know, the first is really, you know, what tends to be collected at your intake or baseline, and this is really sort of, you know, your case characteristics. And so this could include very kind of protected and personal types of information, which you would need to think about from a privacy standpoint. You know, personally identifying information, socio-demographic information about the client and their case, treatment type information, what, you know, stuff around their home living environment and arrangement that may become very critical to the way that you approach the case. For example, do they live with the alleged perpetrator? Are there other people around? Stuff around their social network, who else is in their lives, perhaps as a concerned other who might be able to help. You know, and of course, stuff related specifically to the victim-perpetrator relationship dynamics. We then sort of, you know, there's other category of data which sort of referred to as process data. So this is really sort of like gets into kind of the operations of your MDT. So for each case, for example, what are the number of meetings that you have for each case? If you're an MDT that works directly with their clients, I know some of you would be working in more of sort of a third-party kind of consulting role, but how many visits are you doing for each case? And and this, in the end, helps you generate more kind of summary data for reporting purposes and for your own purposes as to, like, on average, for example, how many meetings are we spending on each case? Deciding whether that's appropriate or not. For each case, who are the key professionals, the key disciplines that tend to be particularly relevant for each case? And again, that informs sort of like, from a resource perspective, do more resources need to be targeted towards different disciplines or professions to bring more of them into the table or less? Process data around, kind of time tracking data. So how long does it take from the time that you refer the case to, it goes through your sort of consultation or your intake process to where you're actually discussing it openly in a meeting? And once you open a case, how long do your cases tend to be open for? This kind of stuff is obviously very important. Stuff around client kind of service utilization. So in general, if once you open a case, are your clients, your older adults, are they accepting your services or your recommendations? If you're not working with them directly, or to what extent are they participating? If you are recommending or referring, X number of services for them to become involved in, how many of those services are they actually pursuing and completing? Are people, are you retaining people over time, or are people tending to drop out? I mean, all of this stuff is necessary to know for your own process in terms of like sort of quality improvements. What are the types of interventions and services that you're tending to recommend for each case? Again, helps you in terms of developing those relationships within your community. What are the reasons for case closure? I mean, why do you close a case? Is it sort of legislated according to some timeline, or is it do you have specific reasons? Like, how do you come to decide that a case can be closed? There may also be process data that's not necessarily related to the case, but perhaps related to your actual team dynamics. So how well are you communicating as a team when you're sitting around a table? As you in terms of following up on next steps, action items, what's the level of sort of cohesiveness within your team dynamic? These sort of team process level kind of data that can help, again, inform how well you're working together, how efficiently you're working together, and effectively you're working together. Are you able kind of, again, process kind of relationship kind of related dynamics between, again, if you're working directly with clients, what is your relationship with your clients? We know that the quality of the relationship between, the practitioner and the client themselves is a huge driver towards whether or not, you kind of are looking towards successful outcomes. So tracking data around that the quality of that relationship. And then we get into sort of more case outcome type data. And by the way, what I'm mentioning here on the slides these are just examples of the types of things for each category. But this would be more relevant, when you're looking to kind of evaluate your intervention or your model. How well are you doing? Is it working? Is it in terms of showing, for example, what was mentioned before, your funders, the value of your program. And so these are some examples of outcomes you might want to consider. So arguably the central outcome for an MDT or any kind of elder abuse intervention is to reduce the risk of re-victimization, right? I mean, we all understand that we're operating within a world of within a practice paradigm of elder abuse. We may not be able to completely eliminate the abuse, right? We can't, that's not always, the older adult has self-determination and they have a big say into the kind of the trajectory of a case. And it may not be that you can eliminate the risk or eliminate, the problem, but certainly working to reduce the risk of re-victimization. Obviously safety, quality of life, problem magnet, how severe is it at the beginning and how severe it is the case at the end. Recidivism, are these cases kind of reopening over time? If so, are they sort of generally moving in a direction of kind of success? And then you may look at sort of updated victim information, updated perpetrator information. So, for example, over time, is the perpetrator accessing any kind of supports that might reduce their risk, such as caregiver kind of relief and respite, or is the victim accessing services that might reduce the risk on their end? Are they connecting with a health services provider? Are they joining a local kind of day program in which they can have sort of more social interactions? Are more services coming to their home to kind of have more eyes on their situation? So updated changes in that regard. So here's where I'm going to pose another question to you all, just to kind of understand where you're coming from. When we think about the actual types of data collection systems that you're working with, how do you actually collect your data? What does that look like, and where is the data stored? I mean, I imagine there's a whole range.
I can tell you what we've done. Initially, we utilized some of the support through the PMT site to use their Excel spreadsheet and created a database based off the tools that they gave us. We put together really messy forms to try to collect that individually as we were kind of going on. And then the rest of it is honestly a little haphazard. There's a little bit here under, in this file in the computer, and then there's another piece here for, looking at outreach and some other pieces. So nothing that is really structured, and it's stuff that has just evolved as we've determined that we needed it or identified the need to keep track of it.
And Denise, would you say that, what if you were to use some of these categories here, what types of data would you say your team is collecting?
So a lot of it for the PMT report was really a lot on demographics, the type of victimization, what services were provided. So did we do safety planning, crisis intervention, provide referrals, collaborate and advocate with law enforcement or the prosecutor's office. It was that type of information initially. And then as we were kind of gaining speed, we started to track a lot more of the meetings that we were having in relation to expanding the team. We're talking like kind of one-on-one and recruiting. We're orienting folks to the team. We eventually got also a lot better and a little bit more formalized with our case review documentation, is even though we were always collecting what was part of the PMT report, that process got a little bit more sophisticated when we added the AIM model to our paperwork, so that we were doing a better job tracking in more minute detail what we were trying to address to reduce risk, and then what those outcomes look like as well.
Oh, that's great. That's great. And were you able to kind of with the AIM model, and it looks like you're kind of tracking risk factors, were you able to get into any kind of change over time? Like, for example, here's the risk factor near the beginning of the case, and kind of somehow evaluating the extent of that risk, and then once the case closed, going back to those same risk factors, to see if that, the extent or the strength of that risk had gone up or down or stayed the same?
In some cases, yes. A lot of times the cases are open and closed relatively quickly, and there's no ongoing support. So we don't get to evaluate like at a 3 or 6 month period of time. But a lot of times we were able to put supports in place that directly reduce risk and had, I guess, at least some peace of mind about maybe higher quality relationships or connections that were made that would help the older adult and that felt productive and were trackable.
Okay, great. Thank you. Yeah, so that sounds like an Excel spreadsheet is it sounds like that's the main kind of tool or infrastructure that you're using.
Correct.
Anyone else? Is anyone using something other than an Excel sheet, or Emma? Please feel free to go.
Yeah, so we use a software called Legal Server. It's, we access it online. I don't know if it's a cloud. It's just a software that we use, and we input the data with the client names. And these are for our clients. But when it comes to the MDT, it's a little bit too soon to tell exactly the best way for us to maintain that data. But like in terms of what our grant is funding, the clients that we take in, we can keep track of everything through Legal Server, and then you can download the whatever data you're looking for, whatever data points, you can just like pull out.
Yeah. Okay. So you're using some kind of like this would be accessible to anyone who wanted to, like this Legal Server, this cloud-based service. Is this does it cost anything or is it free?
I believe it's I don't know the details of it. It's used by all of Legal Aid Society, but I believe that it's, we pay for it. I know that there are like data engineers who we've worked with in the past. And because it's, because of confidentiality, obviously we need to have an account with our Legal Server account to access any of the data. But you can download the data with identifying numbers so that it's de-identified, like if you want it to be de-identified, which we would if we were going to share it, for instance, if we were going to share any information with the MDT, we could pull out the pieces of data that correspond to ID numbers that the client that only have meaning to us, like to connect with those people. But yeah.
And what kinds of data? I mean, if you see some of these categories here, what kinds of data do you tend to collect?
So, I mean, demographic data, certainly, the legal problems, and then there can be like, so there's like general legal problem codes that with the types of problems that we most frequently see, and then there are even more specific, like special codes under that of like the type of service under that type of issue. So things like that. And then we can also ask questions, like we've had questions in the past, concerning if we've done any kind of cognitive status, questions, if there are any concerns there, or general questions that we ask the client about, what kind of abuse or risk there might be, or something like that. And then also we can keep track of our points of communication, with the client, how often we're reaching out to them, how often we're like touching on the case and
Okay. So it sounds like you're sort of crossing a lot of these categories, being into like case characteristics, associated demographic stuff, but a lot of process stuff around like touch points and also some outcome stuff around risk assessment. That's great. So I think, we came across when we were doing our kind of research on this, all sorts of different kinds of data collection systems out there. I mean, some teams are using, paper pencil forms, and being stored in physical filing cabinets. A lot of people were using sort of some of these kind of broadly accessible type database systems like an Excel, because I think it is often a part of their existing Microsoft suite infrastructure, right? That they have anyways. And to be honest, Excel is great. You can do a lot with Excel, and at the end of the day, you can Excel is compatible with a lot of kind of other kind of data analytics software that we often use in research. So it's great. Emma was just describing some other kind of it sounds like you have to pay for everything, but it's something else that's some cloud-based kind of broadly accessible data kind of management system. There's a lot of those that exist out there. and then we also came across a couple of programs that have, gone out and hired a vendor to create, a specialized or custom designed data management system. I mean, but we all kind of recognize that this is not feasible for many of our teams out there. They don't have the budget to do so. It can be very expensive, but obviously the advantage to this kind of thing is that it becomes specifically tailored to your workflow and your process. You can create very tailored kind of custom kind of reports that it generates for you and for your funders, for example. So, I mean, it's all out there. All of these things are out there. We heard a couple of different examples here. Any questions about this before we move on? Or about the types of data those different categories from before? Barriers to quality data collection. I mean, I think this is an important one. So, I'm going to assume that you all sort of want to collect data, otherwise you might not be in this meeting. That you may already be trying, and many of you are, as we've heard, are already collecting data. But it's not easy. And I'm wondering, before I sort of get into some of my thoughts, what are the barriers that you have encountered in terms of, collecting data for your MDT teams? What makes it challenging?
I mean, one issue that we've had is, the different organizations. I mean, it's not really an issue that we've had yet because we're still at the very beginning of we had started the MDT under a previous OVC grant, and so we're developing it further under the grant that we have now. So some processes that are in place, but many that we want to develop more. And so we're still at the beginning of how we're collecting the data, but the different organizations involved all have their own data collection. They all have their own, they have their own system and their own, process, but also they don't necessarily all collect the same data. And so, getting that kind of information on cases, I foresee, in the future that coming into play.
Yeah, no, I mean, that can be like a serious challenge. And so if you're in a position where you're having to draw data from not just your own kind of team, but like from other people kind of who have to send you data, I mean, that can be a nightmare to sort of, it's coming in different forms. It's not being measured the same way or collected with the same kind of response categories, or even necessarily the same, one person might be collecting certain variable using categories, another person's using some kind of scale. I mean, it can be very, very difficult. Yeah. And, in the end, if you say they're collecting different types of data, and so you've got a lot of, when you're getting all that, you got a lot of missing data, right? Because half of them might not even be collecting on a certain variable. Yeah. No, that's really, it's a huge challenge. Yeah.
And Bernadette, 2019 grantee out of Georgia, said the accuracy from the other team members. So knowing what they've supplied or knowing that their numbers are true.
Okay. That's a big issue too. Bernadette, are you willing to speak more on that? When you say accuracy, are you referring to sort of like, in terms of, as Lisa just talked about, the sort of the numbers being real or true, or is it other aspects as well?
Well, just working with law enforcement and deputies and the police officers, identifying a case, for instance, they may list it as miscellaneous when indeed it comes across as neglect or abuse, and have to go through those cases to kind of separate. So then they may not be putting the charges in correctly. System.
That makes sense. Yeah. Anyone else?
Well, let me also speak for a couple of the other folks around who is collecting the data, and how that plays out, and and the extra work that might be perceived around that. Did I get that right for some of you who I won't call out on this, but if you want to say more on it, feel free.
This is a big one.
Oh no, that's huge. That on our end is that, even though I didn't write the grant, I was hired to, facilitate everything that was going on with the grant and all the additional data collection and I would say processes that were built around helping older adults were not necessarily seen favorably, even though I think the outcomes for older adults has been much improved since the grant funding has been given to us. But yeah, nobody likes paperwork, in case anybody wasn't aware.
No, this is a huge one. This is a huge, huge one. I mean, and in my experience, this may be the biggest barrier, right? Is that as it is typically viewed as an add-on, right, to an existing sort of very busy caseload. People are busy. It's not typically integrated into an initial job description, for example. So it's, it is an add-on. So I appreciate you bringing that up. Any other comments about that before I move on here? So, yeah, I mean, I think, let me talk a little bit about, well, I'll just kind of go down the list here, but, there's often a barrier related to resources. So I mean, I think we've talked about some of the lower cost options here, right? Some of the more broadly accessible options that do exist, like Excel or something, some cloud-based option that would have a cost. But there's also sort of the cost of often, consulting with some kind of expert around what kinds of data you may want to collect. But that's actually really important. I'm working with with a group right now who, very, very amazing sort of group of practitioners who kind of took it upon themselves to collect, some outcome data on their cases and clients. But the way they sort of approached it, it really lacks any kind of validity. And just kind of the way they sort of generated the items and all this kind of stuff, and so they're but to kind of consult with some kind of expert can have a cost to it. As we were talking before, it really is often viewed as an add-on, right, into an already existing sort of busy caseload, and so it's very, very difficult for people to do. Often people just don't do it. I mean, I've had that experience on several occasions as well. That's a huge one. I think somebody may have brought up already, but so you decide we're going to collect data. So who does it, right? I mean, often it's practitioners, caseworkers, kind of doing it on top of their schedule. And it wasn't kind of initially integrated into their job description, so you've got to try to figure out how to do that. Another big one I come across is that anytime you talk about doing, collecting data, there's a fear, among caseworkers, for example, that they're going to be evaluated, right? I mean, all of a sudden, I'm going to be evaluated, so that's a big one as well. So so I'm reluctant to kind of collect this data because I don't necessarily want to. Not that people are doing anything wrong. It's just that it's kind of a heightened level of just being evaluated is a concern for a lot of people, and one that I've come across quite a bit. Often the best data, especially if you're talking about outcome-related data, right? The most kind of valuable data is data that's collected directly from older adults, right? Your actual clients or patients, and that's very difficult to do. I mean, I've come across in my own work a lot of challenges with this, and so how do you actually get older adults to fill out a survey? And again, to get good quality data, in terms of evaluation, really you're looking at wanting to collect data both at the beginning of the intervention and at the end of your intervention at case closure, so pre and post data collection. This takes time. I mean, there's a lot of effort involved in that. That's difficult. And then again, to kind of enhance the rigor of kind of any kind of evaluation, you have a comparison group, right? You want to compare the outcomes of the people in your MDT to some other group who didn't get the MDT, to see if your clients or your patients had greater improvements. And so that can be very difficult as well. Okay, and then obviously I think thinking about how to overcome so many things. I don't pretend to have the magic answers here, but I mean here are some ideas. So I think you really do have to kind of frame and structure data collection into, like, to become a part of your actual routine workflow. Like it can't be viewed as an add-on, right? Because people will just see it as as a very frustrating and kind of time-consuming endeavor. So for those of you who are maybe at the beginning stages, the advantage that you have is that you can do this from the beginning. It becomes a regular part of your workflow. So if people are doing, their kind of case reviews and consultations or intake, for example, at the beginning of the the kind of the course of a case, that data they're collecting somehow gets funneled into a database, right? So as a part of the routine workflow. I've also found that if you're going to collect data and a lot of this is about buy-in. So highlighting that data at every meeting or a lot of the meetings. So sort of presenting to your team, here's the landscape of our cases. Here are the reasons for our case closures. Here's the types of cases that we're working with. Here are the types of referrals we've made. Here's how long we're spending on each case, for example. And if those updates become, again, a regular part of your meetings, it kind of, I've just found it kind of becomes a part of people's mentality as to, like, the importance of it, as opposed to this data sort of remaining hidden in the background that certain people have access to, and no one really knows what's happening with it. That can be very, bringing it to the forefront, again, a part of the explicit process, the overt process can be very helpful. And then usually, framing data collection and why you're doing it as a part of kind of, an opportunity for growth and improvement, rather than sort of internal kind of evaluation that people can get kind of worried about. And kind of fostering this sense of kind of like, we're doing something really important here. We have an opportunity to really kind of showcase what we're doing and kind of become leaders in the field as to what we're doing. That mentality of growth and improvement. I would encourage people to, if you have not already, like if you're looking to hire new roles, that data collection should be built into one of your permanent, sort of full-time positions, job descriptions. It can be very appealing to have, like a student RA or some other kind of temporary position do data collection. But these positions often have a lot of turnover. And what happens, I've seen this happen a lot, is that that person graduates, or that person, their practicum or their intern position or whatnot is completed, and it's difficult to kind of pass that on to the next person, even if that other person has been identified. So to the extent possible, this should be integrated to some kind of full-time position, continuity purposes. For those of you who are using paper pencil kind of based systems, I would highly encourage you to transition to some form of computer-based or cloud-based system. And the reason for this is just that it's a lot more efficient. It's a lot less kind of time-consuming, in that when you do want to go grab data, aggregate your data for the purpose of creating reports and reporting, it's just a lot quicker. and you can easily pull up, you can be at a meeting and somebody asks for some kind of update and you can go and pull it. As I said before, I don't think you need necessarily to go out and hire, a vendor that is going to cost hundreds of thousands of dollars to create a tailored system. I mean, that would be great if we could all do that. I do think that some of the existing broadly accessible systems are quite good. Once you do decide on the system, whether it's Excel or one of these cloud-based systems, for example, stick with it for a while. I also have seen situations where over the course of a 5-year period, a team has switched their systems like 2 or 3 times. And each time you switch your system, you come across compatibility issues. So stuff that was collected in the old system might not be easily transitioned into the new system. And it becomes just an ongoing annoyance of you're kind of pulling your data. So try to stick with systems for a longer period of time. And then, approach the data collection with some intentionality and some selectivity. So what I mean by that is, there are probably thousands of different data elements that you can imagine. And I think it's important to be selective. Not again for the purpose of being efficient, time kind of efficient. People are busy. People are kind of not wanting to annoy people. Like being intentional and selective as to which data fields you decide to collect. So that you're getting what you need, but it's not sort of excessive and taking up too much time. Do others have thoughts about this? I mean, I think at the end of the day, this is a pretty important one. I'm just looking at our time. Strategies that you've come across in your own experience with data collection that have been helpful.
I would say actually sharing some of the outcomes can be helpful. Like even just looking at what we have to collect for the PMT is, talking to the team after you've compiled a quarter's worth of data and saying, hey, you know what, like we ended up serving this many people and we provided this many referrals for this service, because I think it's all like chalk marks essentially without being able to see the results of your work. And I think that can be helpful in understanding why we're doing what we're doing and the bigger impact of the work that we're doing by seeing and sharing those numbers.
Couldn't agree more. Yeah, great point.
I could just sort of add on to what Denise was saying. I think an E-MDT coordinator has sort of this unique role. They are oftentimes the ones sort of driving the outcome for the victim, but they're also the ones facilitating the team. And we want the team to develop and evolve in a way that is meaningful for the members, and also so that it can go back to their various agencies and show the need for this. So E-MDT coordinators have kind of 2 sets of data they need to be collecting. They need the victim stuff, but they also need the group dynamic and the outcome that the group is creating as well, which again puts a lot of that onto the coordinator, but that's kind of that's the unique position I think the coordinators hold.
Absolutely. Yeah, I mean, often I think you're absolutely right. The coordinator is the person in the best position to be collecting the stuff. Yeah. I think it's worth it. Do it. You start somewhere. I know a lot of you already have. Be intentional. If you are looking at doing, outcome-based data, I would recommend that you do partner with some kind of trained researcher to kind of design your, the evaluation design and decide on which outcomes you'd want to be looking at. I think those would be some final thoughts. Appreciate everyone contributing.
All right. Well, thank you so much, David, for that excellent presentation. I hope everyone enjoyed learning today. I am going to drop a survey evaluation, in the chat. If you could just take a second to fill that out super quick.
David,
Definitely.
you want to click over to your contact info?
Yes. If you click, I think it's 2 little clicks. There we go. We've got some contact information for David. And great. Well, thank you so much, everyone. Again, check the chat for that link that I sent out. And of course, you will be receiving in a couple days an email from me with resources, as well as recording of this presentation if you do have to go back and dig into any of the specific points we talked about. But let's give a big thank you to our presenter, and I hope you guys have a good rest of your day.